Hi, Miss Hales. I'm Bailey. I'm going to be your nurse today, and I'm going to go ahead and do a head-to-toe assessment on you just to see what's going wrong with you. Before I'm going to fill out my QSIN, so I'm going to ask your name and date of birth. Okay, I'm going to check your wristband. Okay, correct name on the whiteboard. You don't have any oxygen in, no NG tubes, don't have an abdominal drain, no chest tubes, no trach, no Foley catheter, and you don't have an IV in. Side rails, we've got 2, beds in low position, call lights in reach, no obstacles or clutter. Patient's assistive devices are on their side table, water pitcher and cup is available. You don't need a urinal, but your commode is there for you, and it's empty, and a trash bag is attached to your table. Okay. So I'm going to go ahead and start with your head-to-toe assessment. We're going to see what's happening here. So, can you tell me where you're at, and can you tell me the day or month or year? Okay. I'm going to look at your face symmetry. Okay. I'm going to do your vital signs, feel your pulses bilaterally, and feel the temperature of your skin. Do your blood pressure. Look at the respirations. Okay, can I see your hands again? Can you push away or pull away from me? Push towards me. Squeeze my hands. Wiggle your fingers. Okay, I'm going to check your capillary refill. Bilaterally, it looks good. Check your skin turgor. Right, and I'm going to listen to those lung sounds. But before, are you having any pain or tingling in your upper extremities or in your arms or anything? All right. Okay, lean forward for me. Okay, lift up your left arm for me. Okay, and your right. Okay, I'm going to go and listen to your heartbeat too. Alrighty. So you've been having a little bit of problems with your stomach here more recently. Alright. Can you tell me what kind of foods you've been eating? Okay, and have you been having you've been having a little bit of pain in your abdomen area? Alright. Said you've lost a little bit of weight too. So I'm gonna go ahead and I'm gonna lift up your shirt and look. Alright. I'm gonna go ahead and listen to those bowel sounds. Okay, I'm gonna feel around. Alright, and can you tell me last time you've had a bowel movement? Alright, and what are the characteristics of your stool? And have you been passing gas a lot? Alright. Have you ever had any problems going to the bathroom? Have you burning or anything when you urinate? Or any abnormal discharge that you've noticed? Okay, and I'm going to go ahead and check out your legs. Are you having any tingling or any pain, numbness in your legs or feet? Okay. And I'm going to go ahead and push your feet towards me, pull away, wiggle your toes. I'm going to do cap refill bilaterally on your feet, and then I'm going to do your pedal pulses bilaterally. Alright, so so your temperature was at 101.5, so it was a little high. Your pulse was 85, respirations were at 16, blood pressure 135/71, and your pulse ox was at 96. You stated that you are having bloody diarrhea, and you've had your normal bowel movements are 5 to 10 daily, and you said that you already had your 3 this morning. So, some of the things I would educate you on just before you leave your discharge is just to eat if you do have IBS, you need to eat a well-balanced diet, so high in fibers, no caffeine, no alcohol or tobacco. You need to avoid fluids with meals, drink plenty of fluids each day, chew well, avoid any sorbitol or fructose, which are in your beverages. Stress reductions, medications, you can take antidiarrheals, bulk forming, laxatives, anticholinergics such as Bentyl. And some of the signs and symptoms I would look for in IBS before I would assess my patient is pain in the abdomen, changes in the bowel habits, indigestion, constipation, nausea, gas, loss of appetite, symptoms relieved with defecation and mucus in the stool. And later on, the patient did end up developing Crohn's disease. So those signs and symptoms I would look for when she came back to the hospital would be abdominal pain after eating, fever, tenesmus, weight loss, weakness and fatigue, anemia, ulcers in the mouth, bloating, nausea, vomiting, diarrhea, and gas. And also the assessments that I would make sure I look for when I do assess my patient for IBS is look at their bowel pattern changes, palpation of the abdomen. There can be lower quadrant pain or distension. Identify the triggers, observe the mucus in the stool, weight, and their diet. Alright, so I am giving my meds separate from my my head to toe assessment video. So basically the scenario is the doctor just said, or thinks that she has IBS, so he gives her, or orders Bentyl IM 4 times a day. So before I'm gonna walk in, I'm gonna introduce myself. Hi, I'm Bailey, I'm gonna be your nurse today, and we're gonna go ahead and give you that Bentyl that the doctor prescribed for you. And what that's for is that's for your IBS. It helps manage that if other interventions haven't worked. There's no peak or duration for the drug, so it's not necessarily positive on when it'll start or how long it'll last. Common side effects you're going to want to look for is constipation and heartburn. The life-threatening ones are paralytic ileus or anaphylaxis, and you also want to know that the meds cause drowsiness and they cause blurred vision. Stay in temperature-controlled rooms. Do oral rinses, eat sugarless candy or gum, good oral hygiene to prevent dry mouth, change position slowly, avoid any extreme temperatures, let the doctor know of your prescriptions that you're taking, your OTC meds, vitamins, and herbal remedies, and let the doctor know of any pain or increased sensitivity to light. So some of the things I'm going to assess for before I give the patient the medication is I'm going to assess for signs of IBS, assess for abdominal distension, and auscultate the bowel sounds, and monitor their intake and output. And then when I administer it, I'm going to monitor after I administer it because it can cause lightheadedness or irritation at the injection site. And the common amount that's usually given is 20 milligrams every 4 to 6 hours. So we're going to go ahead and give that 20 milligrams. So I've got, so what I'm going to be giving it today, also, I'm going to be giving it into your deltoid, so, which is up in your arm and that muscular part. So I'm using a washcloth today to demonstrate that, and what I'm going to do is first I'm going to wipe off the cap of my container for my med. I'm going to want to make sure that I'm going to want to make sure I ask my patient name and date of birth, ask them if they have any allergies, and then I'm also going to make sure I check my med 3 times, so when I pull it out, after I take it out of the bottle, and before I put it away. So I've got Bentyl. I'm going to put air into And then I'm going to withdraw. Alright, so we're going to just get rid of all that extra air and smack it to make sure we get all the air bubbles out. And I'm just going to recap it temporarily until I get my patient's skin cleaned off. So I'm going to start in the middle and work my way outward in a 2-inch border. So, right. And also I washed my hands and made sure I put on gloves before I started this. So I'm now then going to uncap, and I'm going to make sure I'm 2 finger lengths below the shoulder, make that triangle, and I'm going to give it in the middle of that triangle. So I'm going to give it 90 degrees, poke, and I'm going to administer it. Just hold it for a second and take out. And then you might have to apply pressure, or you get a gauze pad. If I have one, but say this is my gauze pad, just hold it on there just for a little bit so that way it stops the bleeding, and then tape it down and keep it there. Alright, so now I'm reporting off to my nurse. I would tell her this is Ms. Hale. She's a 19-year-old female, came to the emergency room reporting that she had bloody diarrhea. She's told she had IBS in the past, but this was more blood than usual. Usually has 5 to 10 bowel movements a day and already had 3 this morning. Usually it's after she eats seafoods, and she has had lost 10 pounds within the last 4 months, so the provider ordered her Benel-IM 4 times a day. Her vital signs were stable. The provider found Franca-Cole blood in her digital rectal exam. She had a colonoscopy, showed bleeding, ulcer in the transverse colon, which was cauterized, and there was no other signs of bleeding. Thought she had an isolated incident due to the irritation caused by the greasy food, and she was discharged. Then she came back 2 days later, complaining she had bright red blood in her stool, and she had already had 2 yesterday and 5 today. She also reported lower abdominal nausea and vomiting, or lower abdominal pain and nausea and vomiting. Also found she had open sores in her mouth and was reporting epigastric pain. Did an endoscopy, repeat colonoscopy. CT showed she had severe thickening of the mucosa in the small and large intestine with ulcerations in duodenum and ileocecal junction. And then gastroenterologist came in, diagnosed her with IBS and Crohn's disease, and wrote her new medications and said she could go home tomorrow as long as she was stable enough. And her vital signs previously, before I came back in to the doctor's office, her temperature was at 98.7, her pulse was at 75, and her respirations were at 16, and blood pressure was 125 over 65, and then her pulse ox was at 97%. And also, I did know back from when I did my assessment, didn't realize that in the case study it stated that her vitals were normal in the beginning, and then so the vitals I would have gave in the beginning wouldn't have correlated with the first time she came in the visit, but for the second time where she was diagnosed with Crohn's disease.